This is Fox 5 News Morning.
Later, with summer still in season, you may enjoy laying outside and working on your tan. But doing so carries major risks and the dangers you are facing and how you can best protect yourself from skin cancer. The National Cancer Institute says there are more than 2 million new cases of skin cancer just this year alone. The U.S. Surgeon General recently said the growing number is now a major public health problem.
That's right. Studies find that skin cancer is most commonly diagnosed type of cancer in the U.S., and that is also one of the most preventable out there. Joining us right now on how you can protect your skin yourself is Dr. Sanjiv Saini. Did I say that correct?
Close enough.
Close enough. Say it for me so I get it right.
Sanjiv Saini.
Sanjiv Saini with the Dermatology of Maryland. And Doc, thanks for being here. And I think the biggest thing is folks need to understand that skin cancer, this happens for all types of skin. It's like we've got a collection of all types of skin. We added Mike in here of pretty much a lot of folks out there.
It does not discriminate.
Yeah.
Now, in our practice, we've had 270 melanomas in my practice over the last 23 years. Very first melanoma I ever saw after medical school was when I was in the Air Force, and it was on a Filipino lady who had it on the sole of her foot, which is why it's so important to do a full body check. The important thing also is that most skin cancers, the difference between skin cancers and all other types of cancers is that people can examine it and they can find it as early as your physician can. So self-examination, or even better, having your spouse check out your body. I recommend once a month. Our protocols in our office, monthly check. And the key thing is anything that wasn't there before, a pink spot or a brown spot, even if it's an old mole or if it's starting to change in color or size. That's the most important message we need to get out there.
Okay. And another thing is it also doesn't discriminate against age. So when we talk about the 2 million cases, are you seeing more and more younger people being diagnosed with skin cancer?
There are younger people, but thankfully it's very rare, but it is still possible to get a melanoma in someone who's 12 years or younger.
Okay.
In the literature, kids as young as 2 and 5 have been reported with melanomas.
I have never heard that. That's amazing.
It's reported, but thankfully it's very, very rare. The youngest person I've ever had to remove a non-melanoma skin cancer was a 9-year-old. So it's important for everyone to be aware of it. Thankfully, it occurs very rarely in kids who are younger, adolescents and younger, but we do need to check everyone. That's the important thing, is that early recognition. Even when I was in my training, I remember once when I was in my fellowship, I had a 19-year-old Hispanic girl who came in, and the only reason she came in was I gave her father-in-law a booklet on recognizing skin cancers. She herself found the skin cancer on her eyelid, and she's the only one who called me a year after I finished my training to thank me, because after the reconstruction, no one could tell anything happened to her.
And also, Doc, okay, so as for detecting it, I mean, how quickly can something show up? Can it be one day I don't have something on my hand, and then the next day, what is this dot on my hand?
That's a very good question, because the thing is, everyone when they're in their 20s to 40s, many people will have a mole that comes up, and it's an innocuous mole. When I was 25, 26, I was in the Air Force, had a tiny mole appear on my face, had it removed, and it was nothing. But that's also the peak age range for melanomas to present. And the reason we key in on melanomas, those are the ones that show up as moles that are brand new, or old moles that start to change in color and size. Those are the most life-threatening type.
Okay. So as far as prevention goes, what can people do to prevent this from happening to them, in addition to wearing sunscreen, which is a message I know we emphasize every day?
Excellent question. One of the most preventable things is avoiding suntan parlors. The Surgeon General's report, it estimates that as many as 400,000 cases of skin cancers each year can be prevented by avoiding suntan parlors. When we do go outside, prevent blistering sunburns. One single episode with a blistering sunburn, even if a child is 4 or 5, that doubles their total body lifetime risk of melanoma. 2 blistering sunburns triple someone's total body lifetime risk of melanoma. So that's one of the most important things that we need to get out there. Preventing blistering sunburns, using a sunscreen. And one of the simple things about using sunscreen I always get is, how do you use a sunscreen? And I always get people laughing and saying, oh, well, you just put it on. But the most effective way studies have shown to use a sunscreen is put it on 15 to 30 minutes before you start to sweat. And every 90 minutes, put a fresh coat on. So
right.
that if someone's outside, that's simple rules, but very important. Early recognition. The booklets, brown spot or a red spot that suddenly appears, but it's not going away, and it's getting larger over time. Those are the key messages that I think we need to get out to everyone.
All right, Doc,
Very
thanks so
good
much.
information.
Doc, the name again?
Dr. Sanjiv Saini,
I'll get that by tomorrow, Doc, with Dermatology of Maryland.
MD Dermatology.
MD Dermatology. Eventually,
Doctor.
I'll get it.
Thank you
Thanks so
very
much. Hey, good information, Doc.
Yes.
Thank you so much.
Appreciate it.